Hello, everybody, and welcome. We are delighted to be able to have some time with you today. This is going to be an informal conversation with 4 of our current master's students so that they can share their perspectives and their experience, answer your questions, have some conversations about what it is like to be here. We are excited to welcome you to the cohort and to welcome you to the program. I want to start off by asking if you all can just sort of hop in the chat and introduce yourselves to each other. And I want to talk a little bit about you. So I see a couple of familiar faces who were able to join us the last time. This slide will look familiar. And Alexis, I think the view is a little off at this point. I'm going to go ahead and go over this. So what we know about you as an incoming cohort, we know that you are very ambitious with an average GPA of 3.5. There are 8 first-generation college students and 14 first-generation graduate students in the incoming cohort. And you bring this very wide variety of academic and personal perspectives. 44 different undergraduate institutions globally are represented among the applicants, and 30 unique undergraduate majors, which is just this incredibly broad array. We are so excited to see that kind of variety. You're internationally a very diverse group. 59% of you are international, which means 41% of you are US citizens or permanent residents, and there are 16 different countries represented among the applicants. And when we look at just general demographics, 80% of the applicants identify as women, 20% as men, and our average applicant age is 24. So that just gives you a little bit of an overview of the cohort. I am very excited to introduce you to our panelists today. It is a particular pleasure to have 2 of our second-year students and 2 of our first-year students so that you get a little bit of variety in this process. And I will start, and I will just say that in our second-year cohort, we have Suhana Posani. Some of you may have had emails or time with Suhana, and Obale, who is here as a second-year student. From our first-year cohort, Ismail Shekabula and Emily Klein are here with us. Some of you may have been emailing back and forth with Ismail, so I am delighted to have them here. And I see in the chat, I see a couple of people, but please go ahead and continue to, type into the chat and introduce yourselves to each other. And I'm going to open this up by asking our student panelists to introduce themselves and talk about, just for a couple of minutes, their research or their internship project, and what they were doing before they came to Duke, and maybe just why Duke in their initial response. And I will start with you, Obale. And you're muted.
Thank you. It's almost always a reflex. Yeah, my name is Armstrong Obale, commonly known here at DBHI as Obale. I am currently working on a data science related project that has to do with identifying discrepancies across injury data dictionaries from low and middle income countries, and also exploring harmonization strategies. I am a second-year Masters of Science in Global Health student here at Duke. And I chose Duke because I love the way this program is structured. And of course, Duke is a tier 1 university here in the United States. So I felt like having a degree from such an institution that I found to have an incredibly intelligent and diverse faculty and staff body would be very important for me. So while I round off with my project and with my studies, I am very much happy that I have gotten even more than what I thought I would get from here. And I look forward to continuing with what I am doing right now. Congratulations to you all, and nice to have this chat with you.
Thank you, Obale. Suhana?
Hi, my name's Suhana. It's nice to see everyone in the chat. I'm a second year master's student as well, so I'm in the same class as Obale. I'm originally from Michigan, and before coming to the program, I worked a little bit in the medical field, and then I came to do this master's. Right now, my research is in pediatric oncology, and my thesis is about stigma that pediatric oncology patients and their caregivers face in Tanzania. And the reason I chose the program is because I really appreciated the research focus of the program. I liked that you get paired with a mentor, a faculty and research mentor, and they kind of guide you through a research project. And then I also liked the class size, how it was like a pretty small cohort. So, we get to know our professors and the rest of our like fellow students really, really well. So yeah, nice to meet everyone and hope you guys have a good time.
Thank you, Suhana. And from our first year cohort, Ismail? Okay. Well, Ismail, can you hear
Hello?
us?
Yeah, I can hear you. I'm so sorry for the challenge of internet. Yeah. My name is Ismail Shekibula. I'm a first year student doing global health. And I'm happy to speak to everyone here. And I know, as Lisa said, there are few of you. We had a conversation via email, and I'm happy to see you in person. I'm happy to see you here and know your faces.
Is,
Yes.
Ismail, tell us a little bit about your research.
Yeah, I'm doing my research on social determinant of suicidal ideation among people who are living with HIV in Tanzania. And I think it is very interesting to work with this group of people because I really like helping people. And that's why when the opportunity of joining Duke came in, I decided to grab it because I knew that with my experience in doing research, I can shape my research experience while at Duke. And yes, I saw it when I came here. I learned a lot of things so far, and I am still learning because as for now, I'm preparing myself to go back to Tanzania to do a data collection for my thesis. So I can say like here at Duke, you are in a right place. You are in a right path for those who like research and especially globally. You're welcome, guys.
Thank you, Ismail. Emily.
Hello, good to hear from all of you and nice to see all of you. My name's Emily Klein. I'm a first year master's student in the program. My current thesis or research is based around air pollution, so looking at different levels of air pollution and respiratory health outcomes. And I'll be going to Mongolia this summer to do data collection for that. And before this, I grew up in Pittsburgh and I was living in Pennsylvania prior to this.
Thank you so much. Thanks to all of you for giving us some of your time today. I will ask for collective good wishes for Suhana, who defends her thesis tomorrow morning. So we are particularly grateful to get some of her time just before that big event.
And Obale defends in the afternoon.
Obale defends tomorrow afternoon. It's a big day here tomorrow. What you all will not know is that when people successfully defend their thesis here in the program, we actually ring bells to celebrate. So we are looking forward to lots of bell ringing tomorrow for everybody. I want to invite all of you to ask questions. You can put the questions in the chat. You can also raise your hand. And while you're thinking about your questions, I will just get us started with an initial question to the panel. And ask sort of what has the student community at DGHI been like for you in your time here?
I can go first.
Oh,
Oh,
cool.
okay. It's been fantastic. I think one of the really awesome things about the program is it attracts people from, and I mean, as you've said in the slide, like it attracts a huge variety of different people. So we have a ton of international students, a ton of students like from the US, but also in terms of like research interest just by themselves, people, it's like so varied. So people who are interested in like the environmental aspects of health. I'm interested in communicable or non-communicable diseases, but there's also people who are interested in communicable diseases. And so it's been really cool to see like how diverse the research is in global health and kind of all the ways you can like go into the field.
Yeah, just to add to what Suhana has said, it's a very happy student body here. I mean, I remember from the very first day when we came in, we had some kind of outing. We're very happy to hear from one another. We had discussions, we had conversations about the various countries, the various universities we came from, and what we had been doing. So what I particularly like is the welcoming attitude of all the students. I mean, I don't know how DJ Shai does it, but I think the fact that they bring a really diverse student body is a great resource for all of us. We end up knowing a little much more about the world and how things are being done around the world. So it's a very happy environment.
Emily, I'm asking each of the panelists to weigh in on this one.
Yeah, I mean, I definitely agree with everything that has been said. And then I'll just add, like, I think the size of the program makes it so that you really feel close to your peers, like you're in the same classes with them each semester. And so you're seeing the same people every day, and you really do get to kind of quickly build friendships with the people in your cohort, which has been great.
Yeah,
Ismail.
yeah, I agree with my peers here. They said fantastic things. And I have one more point about our community here. I really like the organizations at DJHI because at first semester and second semester, we are doing almost the same courses, like the same classes. So this is very important to me because it helps you to connect with your classmates. Like you connect with everyone before we start to go and do other electives in second year and all that. So that's a very important point. And another point, as Emily said, like we have to do that matching process. So that is very important thing because it connects you to a mentor who you can work with from the beginning to the end. So that's a very good thing here at DJHI community.
Thank you all. Are there questions from you all? I don't want to keep us talking without giving you a chance to jump in.
I can see a hand up.
Yeah, hello, this is Sakibur Rahman from Bangladesh. So first of all, thank you for arranging this nice session. Actually, I missed the first session, but I'm really happy to meet all my seniors or all my future postmates. So it's really nice. So I have two particular questions. First of all, I think in the website or in the site of the MSDS program, it was mentioned that each and every student will get one mentor for their whole master's program, mentor or supervisor, right? So I want to know another thing. It's like a bit prospective, but I want to make sure if I want to switch from the master's to MS PhD, is it possible? Or if I really want, if anyone, not only me, if anyone wants to switch to MS PhD program, should he or she start from now because he or she have to get mentor for the MS followed by PhD, like the both course. So what's the procedure, or should anyone start any kind of communication regarding this pursuance of PhD program? Because it's really what I seen what I've seen till now, it's really a nice campus, nice students, and a total very good faculty. So anyone who will get the opportunity to, what I can say, lengthen his or her course to PhD program or to enrich his or her career, that will be a very good opportunity. Thank you.
Let me jump in here quickly before you all respond and just point out that we do not have a PhD program in global health here at Duke. So the master's program is in and of itself the program at DGHI. We have a number of our students that then go on to do PhD programs at other institutions. And I do think the mentorship piece is key. And so I will, stop and let the panel respond to that question of working with mentors.
Well, Shakibu, I can only talk about working with mentors. I remember when the cohort behind us came in and they would ask, which mentor should I choose? And I would be like, every mentor here is a great mentor. Just choose based on what you want to do, right? And if Lisa can remember quite well, it's like I knew my mentor from the very beginning. I was like, Lisa, I know the person I want. Do I still need to go through the match process? And she was like, yes, Ovale, you need to. But I finally got him anyway, and he's indeed a fantastic mentor. Not because he's better than the others, but because he teaches me what I need to learn. So it's about what you want to learn, not really about the person, because again, they are all fantastic mentors.
Thank you so much. Thank you. That's what I got from this kind of sessions or from your side till now, that each and everyone is excellent mentor, but I am eagerly looking forward to meet in person during the course. Thank you.
Of course.
Paul, I see your hand up.
Hi, Lisa, and hi, everyone. So just with what in regards to what's been talked about, issue of choosing mentors, and I have a question in line with that. I don't know if any of the students that are here today on the panel have had this experience. If you have, please share. I would really like to know. Have you found yourself in a position where you know exactly what you want to do, right? But after going on campus and being exposed to other resources and the professors there on campus, and you realize probably what you had in mind was maybe a bit too shallow, and you have to really probably find I don't know, something better to concentrate in. I don't know if you have, please give more insight on how your experience was and what you would advise any of the students here today. Thank you.
I can jump in. Oh, go ahead, Ismail.
Okay. I think I know a few of our peers who had their own things in mind before coming to Duke. And when they, even in the early days at Duke, they could mention that I want to do this and this. But during the matching process, after they match with their mentor advised otherwise, and they found very interesting. So sometimes the mentor can help to advise you and can shape your, even the thesis or the title you want to work on. He can shape, and but the aim is for you to have a very good pathways at the end of the day. Yes,
Yeah,
Emily.
I think to go off of that, just for me, like it's been kind of just remaining open to what you're learning in your classes and seeing what sticks and what doesn't. So right now I'm in an implementation science course, which I really didn't know much about before starting graduate school. And now being in the course, it's kind of opened my eyes to a whole different like aspect of research and an area that is really interesting and exciting to me, but I would never have known about that until I took the course. So I think there's kind of a balance of being open to new ideas and new directions while knowing what you want.
Either of our more experienced voices want to weigh in on this one?
I can also answer. Great question. I think one of the things that's also important to remember is like, if you have a specific, like a very specific research topic, you might not find kind of exactly, you might not find a mentor or a project that exactly lines up with what you're looking for. But I think one of the things that actually a student said to me really early on in my process was, think about kind of the skills that you want to gain from your research mentor or the research, and like choose a mentor based on that. So for example, for me, I really love the topic and the like research mentor that I have, pediatric oncology. It's not something that I necessarily saw myself doing, but I knew that I wanted to do qualitative research, and I knew that I came into the program wanting to develop like community interventions for chronic diseases. And so even though pediatric cancer doesn't necessarily fall into what I thought it was going to be, the research that I'm doing, I can see how it could develop into an intervention. And so understanding like there is a process to that, and the research that I'm doing can lead to something that I was originally interested in doing, I think is really important. So just kind of knowing like what skills you want to develop versus like if it's qualitative versus quantitative, or just kind of a general area that you might be interested in, I think is really important. So maybe you don't find something that's exactly what you wanted, but you can kind of explore things that might help you get in the future to where you want to be. Does that make sense?
Thank you. Hudson, I see your hand up.
Yeah, hello everyone. I'm Hudson, and I'm in a kind of interesting position where I'm deciding not just between different schools, but between different programs, and I'm kind of trying to flesh out the nuances between I guess the types of experiences and the types of things that I might be learning in these different programs. So I'm curious for you guys. I know Duke doesn't have a Master's of Public Health program, but why did you guys choose to do global health as opposed to public health? And then also, I'm also considering the Masters of Population Health Sciences at Duke. I don't know how much you guys may know or not know about that program, but if you guys had any insights into, I guess, the distinctions between those programs, that would be very helpful.
Hi, Hudson. I'm not very sure about what happens at population health, but one thing I know is that here at the Duke Global Health Institute, and specifically in this program, Masters of Science in Global Health, we are looking at global health through the lens of ensuring that there is equity in health for all people. So it's a kind of blend between clinical practice and public health. So there's a gap between clinical practice and public health, and that's the gap global health is filling. And then it transcends international borders. So I think that it goes back to what you really want. Again, I can only talk about what I know. I can't talk about what I do not know. But prior to coming here, I had a master's degree in epidemiology and control of infectious diseases. And EPI is known as the main cornerstone of public health. But I saw that I needed skills to expand, to transcend boundaries, to work without limit. And that's why I came into global health. So I think that it's kind of taking a reflection on what you truly want and then going for it. But it's a very important question you're asking, and I really appreciate. Yeah.
I can add a little bit on as well. I'm not totally sure about the population, like the masters, but I know there's several people from our cohort, from mine and Abale's cohort, that are actually pursuing population health PhDs after our program. And so I think if maybe you're not totally sure, and I don't know if you want to do a PhD, but if you're not totally sure about population health, I think doing something like our program where you're not maybe totally sure about like focusing on one place or the other, it is a good, you do get kind of a good like variety of viewpoints. And so you do get a little bit of population like health and sciences. You also get policy, like Obale said, like you get a little bit of everything. I also was considering public health programs before I came here. I think for me, the main difference was public health programs tend to be more kind of like policy focused in my experience. So like if you do like some of my friends are in public health programs and they are more focused on like getting internships at like state levels and like in like state government, versus with this program, it's more of a research focused program where you can get involved in policy. But I think the majority of us are interested in like in global health research versus like policy.
Emily or Ismail, anything to add to this?
No, I would agree with the kind of research versus less research focus of the MPH program. I mean, I think, yeah, with MPH programs, you can do research, but this program like creates a pathway that's so that you have a clear research mentor from the start. And so it's been a really great way to like gain those kind of hard skills in like quantitative and qualitative data.
Yeah, I agree with everyone here. They said very nice thing. And I would add on the issue of global health, once you have a global health, you can do other things in the future as well. For example, the population health in PhD, or you can do other stuff. Like you have a very wide area of trying to do some things after graduating here. That's why I think global health for me, it is always number one.
That works well. Thank you all. Paul, I see your hand up. Our other Paul.
There's so many Pauls. I don't know if it's mine. Can you hear me?
Yes, we hear you.
Okay. Thank you all for taking our time to do this. My question is regarding the research project. So I noticed that a number of people that I've spoken with, there seems to have their research project set in Tanzania. So I want to put it out that if I want to do my research project in another African country, is it possible, or there's a kind of partnership between Duke and Tanzania that kind of makes it necessary to do the project in Tanzania? Thank you.
No, well, no, definitely not. Me and Obale, out of like the 43 people, they managed to get the 2 people who did their projects in Tanzania. Definitely not necessary. Oh, sorry, 3 people who are doing, because Ismail also is doing Tanzania. Definitely not necessary. There is quite a bit of research that's done in Tanzania, but I mean, there are people who went to India this summer, who went to Madagascar, who went to Latin America. So it just really depends on like where your research mentor is located, like where their projects are and where your project is. But yeah, I mean, there's even research done in Durham as well. So wherever you have interest, there's probably a project for it.
Yeah, I will say that the cohort that is headed out shortly into the field, so that is Emily and Ismail's cohort, there are 11 different countries represented in their field projects. And yes, a lot of them are going to Tanzania too. That is, Tanzania is one of the longest standing collaborations we have, which means that it's the richest, and there are lots of different opportunities because of that, but it is certainly not limited in any way, shape, or form for people interested. Other questions?
Yeah, so just a follow-up to that.
Mhm.
So do you have any Nigerian-based collaboration? I would like to know that. I would like to know if there's anything like that.
At this point, there is not a Nigerian partnership agreement with DGHI, but we actually have sent students to Nigeria on individual projects several times over the last decade. And I believe we have at least one, perhaps two students headed there this summer. Nazareth, I see your hand.
Hi, yes. How's everybody doing? I just had a quick question. So I am Honduran, and I remember us talking a little bit about there being collaboration with Honduras as well. So I just wanted to know if perhaps like anybody had any experience with that, like maybe they went to Honduras and like what was the highlight of kind of those working with, you know, the different countries and like the kind of work that was applied during these like trips and like things that were done, if possible.
So I don't think anybody on this panel was in Honduras through this program. I won't speak to anybody's prior experiences to perhaps working in Honduras, but I would love to have you all respond to the broader question of what types of things were you doing where you were.
Well, mine was a data science related project, and because I sought to explore harmonization strategies for injury data from Tanzania, and of course to harmonize injury data from Tanzania Kilimanjaro Christian Medical Center, I moved over to Tanzania and I was based at KCMC. And there, what I did was try to look at the available data structures and see how these data structures are set up and see how they are functional, so that I would better understand how and which methods to use to harmonize the data. So, I mean, whatever you are doing really depends on your project. Some of my classmates with whom I was in Tanzania went out to the field on a daily basis and collected data together with their research assistants. So, I mean, it really depends again on what your thesis is about. Yeah.
Thank you so much.
I see a couple of hands up. Nimi?
Yes, it's Niami.
Niami, thank you.
Hi, my name is Niami. It's an honor to be here and meeting all of the student panels, wonderful students. I do have a question about what is some of the experience that you gained throughout the program, and like what what experiences have you gained from the program itself, and also what is one of the most highlighting event that you've learned from the program, and like, you know, trips that you've taken with the program itself, and like the studies that you did.
Should I call on somebody or will you thumb wrestle to answer first?
I can go again. I have a whole ton of things I have learned and I can speak from now till tomorrow. In fact, just before this meeting, I was here with my mentor and I told him, oh my, I have just transformed so much for the 2 years I have been here. And I believe that the way this program is structured is such that it brings out the best of you. I mean, if you two are willing to push. So it's really been fascinating to see how the mentors, even the class professors, can invest a lot of their time, as well as the staff. Anytime even out of working hours, I've had to meet Lisa somewhere or meet any one of my mentors or advisors, and they've been really helpful. They've been responsive. We've had to set up a meeting after working hours. I remember it was around 6 or 7 p.m. just because I had issues that needed to be attended to. So there are a whole lot of beautiful things about DJSHI and about this program. And sometimes I say, thinking that I'm going to leave very soon is a bittersweet kind of experience. Yes, I'll soon graduate with MSc in global health, but again, I can't stand missing this wonderful community. And I bet you surely feel same when you come here. So there are just so many beautiful things about the place. I can go on and on.
Yeah, I agree with everything Abale is saying. I mean, I've only been here a year, but I think in thinking about like the classes have been really eye-opening to give you like a bigger picture of global health, of public health on the global scale, and really understand like how it works. And then also like, I just think the people, like, I think it's really unique to be in an environment with people from all over the world who have such expertise. Like there's just people with a ton of different backgrounds in this program that it's just been so like wonderful to learn from and get to know. And I think like as far as the big memories that stand out so far, they all involve just like conversations with my peers and with professors, just kind of those one-on-one connections that you make with people from all over. So that's been really great.
Yeah, I agree with Emil here. And as the name of the program itself, like global health, and it includes the diversity. Everyone's here has his own experience, background. Like when we are meeting here, we are sharing the culture and everything. So the situation of meeting here itself, it helps us to learn. We have learned a lot of classes here, but sometimes we are helping each other, like gaining from us, understanding from everyone's. For example, I can tell you about my experience in Tanzania about mental health. I can hear something from Emily about mental health. So the way Americans are treating mental health is different from how Tanzania we are treating mental health. So through that experience, we are learning from each other. And also our mentors, they are treating very well. Our professors, they are treating us very well, like helping us to understand things globally. Not like we all know that everyone knows something in its own boundaries. But once you are here, they help to open up your mind so that you can think globally. That is a very important thing.
Oyen, I see your hand up. Oh, and Sai, I see Sakabor, I see yours as well. Oyen, and then Sakabor.
Hi everyone, it's great to be here. So I have two questions. Can you hear me?
Yes, we can hear you.
All right.
Question one.
I have question one is concerning the weather. Now that's something I saw on the website. It says you guys have good weather, but good weather is kind of like relative, and some of it, well, I personally I'm in Nigeria, and there's a huge difference in what good means to me. So if you could discuss more about the weather, how cold does your winter get? How hot does your summer get? That's one. Two, for the last meeting I missed it, but when I watched the recording, it spoke about fellowships. So I'd really just like to know more about what fellowships are, what the kind of perks of doing fellowships, and then the application process, what it entails, the requirements and all that. Thank you.
Well, I think we start with the weather.
Yes, please.
Okay, that's a very important question, Oyin, and I choose to speak intentionally because I am from Cameroon, which is very close to Nigeria. So I really can't think of a better place I would have lived in since I came here. As a matter of fact, we didn't have snow this year. And last year we had snow. But when you compare North Carolina to other states, particularly the states in the West, you see that it's indeed friendly and good weather. It may not be the weather of West Africa, but it's weather good enough for you and I, at least compared to other states in the US. Yeah.
Suhana, I need to hear from you on this because I'm watching you laughing.
So I'm from Michigan, which is like, it's like winter, like probably 8 months of the year. So one of the reasons I moved to the South is because I was like really sick of snow. So living here again, I don't know the climate in Nigeria, but the winters are relatively mild. There's not that much snow, and like you can get by with kind of a heavy coat, I would say. And then the summers are not too bad either, not too hot. So it's manageable. People, I think most students who, like international students who have never been to the South are do well in the winter time.
Any urge to weigh in or different perspectives on how hot it gets here from either Emily or Ismail?
Yeah, I can say the weather is friendly. Like, it's not that bad during the cold, and it's not that bad during the summer. For me, maybe because I'm coming from Tanzania, I can say that it is manageable. Yeah, for me, I was able to control myself with this kind of weather. Yeah, I visited Utah in the December, and it was all over the the city. It was full of ice, cold, and everything. So at least here, it's a very nice place for me.
So the second question that you had, Oyin, was about fellowships.
Yes, fellowships. The mention is in like the previous meeting, one that took place, I think 2 days ago, but they didn't go in depth into it. So I just wanted to know what they are, what they entail, and application process. If I dropped the question in the chat box, but I just started to verbally, say it.
No, I appreciate that. I'm trying to watch the chat, but I appreciate you bringing it up. I honestly, and I was in that meeting a couple days ago, so I'm not sure exactly which the fellowships were being referred to. Does fellowship ring a bell for any of our panelists? Yeah, so it's more, we have an internship pathway. And the way, and there are internships available in the second year. There are some programs on Duke's campus where our graduate students have been part of a Duke campus initiative. There's an Emerging Leaders Institute, and graduate students from our program routinely participate in that. But fellowships that would be things like Fogarty or those types of fellowships would be before somebody joined the program, that they would join the fellowship and then be a fellow within the program here. But there aren't sort of additional fellowship structures. So if you remember specifically what was referenced, and I will go back and look myself, I will dig it up and look at it, but it may have been more the internship discussion that we were having at that point about the fact that there is an internship pathway within the program that would place students in global health organizations locally in lieu of doing research in the summer. So instead of a summer research project, you would be working with a global health organization over the summer, and your deliverable there is not a thesis, but a master's paper. And I'm happy to talk a little bit more about that, or happy to answer email questions about it if people would like to do it. It's a pretty small part of the program, but one that is growing. And I want to make sure that we have time for one last question from Sekabor, who has been very patient with his hand up.
No problem at all. Actually, I was enjoying the answers and as well as the questions, and each and every question was very much interesting and useful. But I want to know about some other issues like we are enrolling in MSG program, but is there any prerequisite like we have to learn a bit more of biostatistics, or we have to learn R or any kind of that kind of data science program? Because our current students are putting some light on the data collection, research project, etc., etc. So is there any prerequisite for enrolling in this program? Like we have to learn now the more than the basics of biostatistics, extensive biostatistics, or R or any kind of data science like that. So please, thank you.
So are you asking about having to learn prior to enrollment?
Yeah, exactly. Prior to enrollment, do you have to learn anything for the course? Right.
So generally, no. The classes are formatted in such a way that they kind of teach from like ground level. So there are people who have come in like knowing other coding languages, Python, Stata, but when they teach R and when they teach biostats and epi, they teach it under the assumption that you don't know anything, which was great for a lot of us because I didn't know anything coming in about epidemiology. So you don't have to know anything coming in. If you want to learn some stuff about coding, like that's up to you. And then based on like those classes, there's like other more advanced classes you can take. So for example, in the fall of your second year, you can take or intermediate epidemiology, which is something I took. And that was just kind of based off of my experience in beginner epidemiology in the first year. So no prerequisites needed as far as I know.
Yeah, that's a little bit relieving, because I was a bit cautious that I have to learn, and I was trying to allocate sometimes learning that by statistics, but after your answer, I am a bit relieved. Thank you so much.
Yeah, in addition to that, I think Emil will second me. When we were at home, like you now, we were provided with something just to prepare ourselves for the biostatistic. So that is not out of Duke, but our professor sent us a course outline, and she said like you need to prepare this and this and this before the first day at Duke. So expect to get that, because I don't think if we change our professor, I think it should be the same.
That is very true. Yeah. Yeah, Dr. Turner routinely sends out ahead of time to admitted students sort of a biostats pre-enrollment package so that people can begin to familiarize themselves with some of the concepts or look at some of the materials in advance. It's not an expectation that you've completed some kind of key coursework before, but it's always helpful to have that sort of pre-engagement look at things. We're just about out of time, and so I want to make sure that I see that there's one more question in the chat that I want to answer, and then I have one last question for our panelists before we head off. So Hudson, you had asked about what time are classes in the first year, and is it variable? Emily, I'll toss that to you.
Yes, I think it's variable. So like your first semester you take 3 required courses, and your second semester you also take 3 required courses during your first year, and those are like generally from like 10 a.m. to 2 p.m. But then there is like one that's at 8:30 a.m. I think. And then, yeah, then usually you'll take 1 or 2 electives, and those can kind of vary. You can pick them depending on your schedule. But all the classes meet either like 2 or 3 times a week. So it's very manageable, I would say.
And one more thing, in first semester, most of our classes started at noon. It was really a nice experience. Most of them started at noon. Yeah.
I cannot guarantee that the schedule will be exactly the same in the incoming cohort because I'm betting that Obali and Suhana don't remember that classes started at noon in the first semester. Okay, well, I am very grateful for the time that we have had with you. And I just want to ask each one of our panelists if they have any concluding thoughts or sort of words of wisdom. You all are within a year or 2 years of being exactly where our attendees are at this moment of trying to make decisions in a very complicated space. So what would you say to them? And in this case, I will start with you, Suhana.
Okay. Great question. I'm trying to gather my thoughts. Yeah, I mean, it's a great program. I've had a really great experience. I came into the program wanting to get more research experience, and I wanted to kind of make connections with both my peers and professors. And I think the program is well suited to that. Because you do like get paired with research mentors, and it is a small cohort, so you get to have those one-on-one connections with like research mentors and faculty. And I definitely feel like next year, or even in a couple of years, if I reach out to any of the faculty members or any of like the research mentors, I genuinely believe they'd be like, oh, hey, like it's so good to hear from you, like how's everything going? And so that was really important to me. And so I think like going forward, if you're choosing between multiple schools or multiple programs, just kind of think about like what you want out of the program and try to make a decision. It's a hard decision, but yeah, think about kind of what you want to get out of it and try to pick based on that. But congratulations to everyone. Good luck with everything. Yeah, it was nice to meet everyone.
Thank you, Suhana. Obale?
Yeah, I feel like I don't have much to add to what Suhana has already said. She has kind of said it all. But I'll just add that just remain focused. And if you feel like you don't have a sense of direction, as Emily earlier said, be cool and be free-minded. The direction will come naturally as you take your courses and as you interact with professors. Once again, congratulations to you all. Enjoy DGHI.
Thank you, Obale. Yeah. Ismail.
Yeah.
Parting words of wisdom.
Yeah, thank you so much. And I would say, welcome so much. We are very happy to see you in the fall. And please, if you come here, please ask. Ask, ask, ask. We are here for you guys. And because we were helped by others, we were supported by others, we will support you guys.
Thank you, Ismail. Emily, wrap us up.
Yeah, congratulations. This is so exciting. And I mean, I think all you can do is just gather information and talk to people and ask questions, and only you know what's best for you. So I think like no matter, the advice is all really helpful, but ultimately like just, you know, listen to yourself. And this program is great. So I hope you decide to come here.
Thank you all. And if you are open to students, to these folks emailing you, drop your email in the chat for them before we head off. Thank you all again for giving us some of your time. We are incredibly grateful to have the opportunity to speak with you. And some of you may have heard me say this in interview conversations, if you think of a question that you wanted to ask and didn't get a chance to, send me an email and we will try to get the answers to you as soon as we can. We look forward to welcoming you all in the fall. Take care, everybody.